The doctor is always known to give a patient new life when they are at their most vulnerable. But there was a doctor who had killed more than 250 patients and appeared as the world's most horrific serial killer in an English history. The story of Dr. Death was extremely disturbing and truly shattered the people of Britain. From 1975 to 1998, the prolific serial killer Harold Chipman maintained his position as the expert family physician to kill more than 250 patients by injection. Misusing patients' trust, Harold first diagnosed some serious illnesses they didn't have and later on injected the dose of diamorphine that killed them. What was the motive of Dr. Death behind killing 250 people? Why has no one caught him doing these killings for a long time? What happened to Dr. Death when his crime was exposed? Before knowing the answer to these mysteries, make sure to subscribe to this channel and hit the bell icon. Let's proceed to the most horrific, disturbing and shocking case of Britain. The childhood of Harold Chipman was similar to that of every normal child living in Britain. Chipman was born in 1946 in England. He was born in the home of working-class English family. His father was a truck driver. Chipman's family was quite religious. He possessed brilliant academic and athletic achievements. His personality in High Pavement Grammar School was known as a loner, and he appeared disassociated with their class fellows. But this also does not justify him becoming a serial killer. Experts believe that the turning point of Chipman's personality was in the incident when his mother was diagnosed with lung cancer. His mother was in extreme pain and Chipman keenly observed how the medical expert eased his mother's pain by giving her a dose of morphine to his mother. It was speculated that Chipman was inspired by this concept of how doctors ease the pain of patients by giving them painkillers. Later on, Chipman got married while he was studying at Leeds University Medical School. He had 4 kids and lived the picture of normality. After graduating in 1970, he worked as a junior doctor, got a promotion and became the general practitioner at West Yorkshire Renowned Medical Centre. In 1976, a team of the young doctor was caught giving Demerol to the patients. Demerol was an opioid and the type of narcotic medication used to minimize severe pain. Chipman was utilizing Demerol for his personal use and became addicted. Chipman was fired from the medical center and went to the rehabilitation center in York. He left the addiction of an opioid and returned to his work in 1977 at Donnybrook Medical Center. He made his reputation as a helpful and competent physician for the next 15 years, but no one ever knew that the good doctor was giving the dose of lethal injections to the patients. In March 1975, Chipman forged a prescription of diamorphine to a 70-year-old patient, although he already got his hand on enough of this opioid to kill over 100 people, and no one even knew about his past. Rather than firing Chipman on forging a prescription, he just received a warning letter from the regulatory body of the Medical Council. As believed by investigators, Chipman stopped and restarted murders several times throughout the decade of his terrible crime. But the method of killing was the same. The strange part of his criminal activity was that he only targeted people that have old age. But it was later known that his youngest victim was 4-year-old child. Chipman killed that innocent child when her mother was away for only 10 minutes, making a cup of tea. Most of the victims were 41 to 93 years old. It was believed that he killed 71 patients at Donnybrook Medical Center and remained while doing one-man practice. Overall, Chipman killed 171 females and 44 males, but it was estimated that the real killing was in between 250 to 450 patients. In the year 1998, the undertaker of the Hythe community became suspicious about the death of Chipman patient, while the neighboring medical practice also showed the concern that the death rate of patients became 10 times higher compared to the previous years. They registered complaints to the local coroner, and Great Manchester Police came into action. This seemed the end of Chipman terror, but it was not. The Manchester Police was unable to investigate any criminal record. If the police asked the medical board regarding Chipman's past, they did have opened that Chipman had forged prescription and never been fined and fired. Furthermore, he also covered his criminal activity by showing false illnesses on the medical records of victims. Therefore, the police did not find any evidence and Dr. Death was free to kill more people. How Chipman's crime finally exposed him. A former mayor of Hythe named Kathleen Grundy, who was 81 years old, came to Shipman for treatment purpose. This is a time when Shipman's crime was finally uncovered, when he tried to forge her will. After giving diamorphine, he utilized a cremation box to hide the pieces of evidence. He wrote her will that was leaving everything to him. However, Grundy was buried, but her daughter was suspicious about how her mother can leave everything to doctor. The will document was also written so badly, and this did not make any sense. Grundy's body was exhumed in August 1998, and diamorphine was present in her tissues, after which Shipman got arrested on 7 September 1998. After 2 months, 11 more bodies were exhumed. Manchester police investigated Shipman's computer and found that he had written the incorrect causes of death on the death certificates. Meanwhile, Shipman emphasized that Grundy was already addicted to heroin and highlighted his will as the piece of evidence. Further, 14 cases were investigated, found overdoses of diamorphine, incorrect records of patient deaths, and manipulating their medical histories to indicate that their death was obvious. However, Shipman denied the murder charges and never cooperated with criminal psychiatrists and police. When Manchester police showed him some of the victim photos, he closed his eyes and refused to look at the victims. Police only charged him with 15 murders, but the investigators estimated that the killing could be around 250 to 450 people. In 2000, Shipman was given life imprisonment with never be released recommendation, but Shipman committed suicide on 30th January 2004 and hanged himself in prison one day before his 58th birthday. He mentioned in front of the probation officer that he might commit suicide so that his wife obtain his lump sum and pension. Various theories have been discussed to explain why Shipman had killed his patient. Some believed that he was inspired by the childhood incident of using diamorphine to ease his mother's pain, while others showed charitable opinions that Shipman offered compassion to his patient in a wrong manner to ease their pain. The last possibility was that he felt pleasure from the knowledge that the doctor had the power of giving life or death to the patients, and murder was the one way to express this power. Still, the motive of Shipman is unclear, but the financial gain was not his motive at all. Appreciate our effort by subscribing to this channel. Share this prolific murder mystery of Dr. Death with your family and friends.